Welcome to the Nursing Dose with your host, Dr. Farah Laurent. Today, I want to talk to all my new nurses out there. Maybe you have an upcoming interview. Congratulations. You're probably super excited and probably also nervous because you don't want to blow this opportunity. You want to be successful and you don't want to blow your next nursing interview. So, let's talk about it. Let's dive deeper into this specific topic. And I'm going to share 5 tips that will prevent you from blowing your next interview so that you can actually slay, be successful, and actually get an offer, preferably a same day offer. So, for those who don't know me, my name is Dr. Farah Laurent. I am a keynote speaker. I'm a new nurse coach, right? I'm a nurse career coach, and I've helped over 200 nurses like yourself land their dream role in record time. We're talking in less than 3 months, some as fast as 1 week, in preferred specialty areas like the ICU, the ED, NICU, labor and delivery, psych, and the list goes on. In competitive markets such as Northern California and New York City. So, if you want to be successful in your next interview, make sure you watch until the end because I'm going to share 5 tips on how to prevent you blowing your next nursing interview. Okay. And if you're interested to learn more and dive deeper into these topics, make sure that you click the link in my bio. I have an upcoming free webinar for all senior nursing students and new grads that are looking for more tips and more strategies on the job search and interview tips. And again, like I said, it's free. It takes 1 minute to sign up. The link is in the bio, or you can simply go to newnursejob.com. For everybody that's watching on LinkedIn, I'll drop it there. Everybody that's on TikTok, like I said, the link is in the bio. On Instagram, link is in the bio. Same thing with Facebook. And also, if you're watching from YouTube, if you simply go to my description section on my YouTube channel, The Nursing Dose with Farah, you'll be able to also click on that link and be able to register directly to this free webinar. Okay. And it's live, it's not recorded, and you'll have the opportunity to ask any question at the end of the webinar. So make sure you attend. It's this Thursday at 1 p.m. Eastern. So let's get into it. Shout out to everybody that's joining here on TikTok, Instagram, LinkedIn, YouTube, and Facebook. If you happen to be watching the replay, please also drop any comments or questions that you guys have, and I'll come back and answer any questions that you guys have according to the job search and interview. Okay, so let's get into it. My number one tip so that you do not mess up your interview is the thing that they ask every single nurse when you get to the interview stage. The very first question, and I will bet everything on this, will be, tell me about yourself. Okay, that is a classic question that they ask everybody. Some slightly different question that they could ask you is, walk me through your resume. It's essentially the same thing. What is that question asking? They want to know about you, and they want to know if you're a good fit for this particular role that you're applying for. Maybe it's to be an ICU nurse, or maybe labor and delivery, or ER, or pediatrics. Whatever the case is, that answer should answer, why should we hire you? Who are you? And what skills, experiences have you acquired that make you really good for this position? Okay. When do you prepare for that? Tell me about yourself. Not in the interview. So many nurses that I speak to don't know how to answer this question. They get so nervous, they get anxious, and they try to think about it on the spot. That is the wrong thing to do. Okay. You should definitely have this answer already prepared. And I'm not talking about word for word. I'm just saying you should have the framework of how you're going to answer the tell me about yourself question. So if you're wondering and you're like, hey, Farah, come on, drop the gems, let us know, give us give us some tea on how we should answer this. I dive deeper in my webinar, so that's why you need to go sign up, newnursejob.com. But I'll drop a quick hint here, okay? The first phase of this tell me about yourself question should answer why you went into nursing, what is your why origin story, and why this particular specialty. For me, it was emergency medicine that I absolutely loved. And it actually stemmed from watching a show called Life Trauma in the ER. I was obsessed with that show. And I was like, you know what? I want to be a trauma nurse. I want to be an emergency nurse and work in trauma and do exactly what they do on this show. And funny thing, that's what led me to get to nursing school. Absolutely loved being in the ER in my last rotation. And my clinical instructor asked me, like, hey, what type of nurse do you want to be? And I was like, I want to be an ER nurse. And she literally laughed in my face and was like, you'll never be an ER nurse. You should stick to med surg, and you're too unorganized. And I was like, nope, I'm not going to med surg. I'm going to be an ER nurse. I was so convinced. And you have to have that same level of conviction when you go to your interview. Okay. So that's my backstory about how I got really interested in the ER. Did my last rotation in the ER and absolutely fell in love with that high intensity, fast pace, and really dealing with the community, being able to connect with so many different people. And it was never boring, and it was always exciting. And that was the passion. That passion you have for that specialty needs to come through in this tell me about yourself origin story. Okay, so that's the first phase. Why nursing? Why that particular specialty? And what qualities and skills make you a good nurse and a good fit for this role? So I'm talking like what type of personality you have. Like, are you empathetic? Are you adaptable? All of those things. But then you also need to really focus on the clinical skills that make you a really good fit for the ICU, the ER, labor and delivery, psych, whatever it is. Hone in on those skills and be able to articulate that in this interview. And just instead of just listing a bunch of skills, be able to at least demonstrate one quick story of how you did something. If you can do that, okay? And it doesn't have to be anything long, like literally a one-liner, okay? And then the last part of that pitch is why should they hire you and why are you interested in that particular organization? And this is almost like what do you bring to the table, right? It's like, okay, cool. Why should we hire you? What are you going to bring differently than all these other candidates? That is the time to wow them and bring that conviction and say, hey, I really care about my patients. I listen to my patients. I connect well. Even my clinical instructors have told me this, this, and this. My patients personally tell me that they feel comfortable. And this is the type of patient experience that I'm going to bring to the table. I'm going to be involved with the unit. I'm not just here to clock in and clock out. I'm dedicated, and I'm going to, be accountable for my own learning and have continuous learning. And that's why I'm so excited to be here and to join your team. Boom. You got to be able to promote and market yourself. All right. So that is what the tell me about yourself question is. Essentially, it sets the whole tone for how the interview will go. If you're not prepared, you don't deliver it with that conviction and that passion and that authenticity, and it sounds generic and it sounds like everybody else, you're going to be forgettable. And that's not what we want. We want you to be unforgettable so that you move to the next phase, and better yet, that you actually get the offer. All right. So again, if you find this valuable, let me know in the chat. Let me know, put interview pitch, if that was valuable. Let me know if you have any other questions. And again, let me know if you signed up for the webinar. It's this Thursday. Go to newnursejob.com. The link is in the bio. What is this webinar about? It's literally me talking about these particular tips and diving deeper into how to interview and how to get interviews and how to get hired faster. Typically, my clients are getting hired in less than 3 months, some as fast as a week. Literally, I just shared a testimonial about Avery. I just dropped it a couple days ago on TikTok and also on LinkedIn. And I think maybe on Facebook, I'm not sure, but we worked together for 2 weeks while she was still a nursing student in New York. She was able to secure a surgical ICU position, SICU, in the #1 hospital system in New York and in the nation, NYU. I used to work there. In 2 weeks of just working with me. All right. So this is what investing in yourself means. You have to be able to invest your time and also invest in the things you want. So for Avery, she was like, I need professional help. I want a nurse career coach. Of course, she came to the best person, me. And she was like, I'm ready to invest. I'm ready to get what I want. Even though she was hesitant, I must say, like new nurses, she was hesitant. She's like, am I really worthy? Can I really get this ICU position? Will I be able to handle it? And I was like, yes, I'm the ultimate hype woman. I'm like, you got this. You can do it as long as you are in a organization that's going to support you. And there's no better organization than NYU. Literally, it's the #1 hospital system. So that's what I want for you. I want you to not only just find any job, I want you to find the right specialty area and do not listen to negativity. Don't listen to people telling you that you can't get ICU or you can't get ER or that you have to go the traditional method and go to med-surg. You don't. Okay? You can get what you want. And I don't want to hear, yes, it's competitive and the job market is oversaturated. Let's stop all that and let's have a positive mindset. And you have to have strategy. You got to be strategic and you got to be willing to do things that other nurses don't want to do. That's why all my clients are getting jobs in record time when their counterparts are sometimes waiting 6, 9 months up to a year. So I will see you at that webinar, free webinar, newnursejob.com. Sign up. If you're just joining me, I'm breaking down 5 tips that you can be successful in your next interview and how to avoid blowing your next job opportunity or your next nursing interview. Number 1 is to tell me about yourself question and how to answer it. Number 2 is you got to prepare your stories, your behavioral style stories. Okay. Many think that they're just going to go to the interview, listen to the questions, and just make it up as they go along. Wrong. Not a good way to do this because most of us have a hard time remembering things. Like literally, I can't even remember what I did last week. So why would you want to leave it to the last moment and wait until they ask you a behavioral style question and then you're like, let me think about it? No, you should have these stories prepared, tucked away in your back pocket and ready to use them. And then there's a special framework of how to tell the stories that we go through, and it has to be compelling, engaging, and moving in a way that they're like, wow, I really want this person on my team. All right, Jasmine. So Jasmine Pryor says she signed up. Awesome. Let me know if you've signed up. If you're on TikTok, LinkedIn, YouTube, Instagram, or Facebook, let me know if you signed up. So I can't wait to meet you on the webinar, Jasmine. And let me know what specialty area you want. Drop it in the chat. Everybody that's here, if you are a new graduate nurse, a senior nursing student, drop any specialty area that you want. Or maybe if you're an experienced nurse and you're watching this and you're like, can I come to this webinar? Absolutely, come through. If you are a nurse that's currently in a job that you can't stand and you hate, maybe you're in long-term care, maybe you settled for a nursing home and you don't really like that and you want to work in pediatrics or you want to work in neonatal, or maybe you're in an outpatient setting and you want to move to the acute care setting in the hospital, or you just want a critical care or more challenging role, or vice versa, whatever it is. You want a better schedule, come to the webinar. Literally, I've helped so many nurses, even nurse practitioners, get into roles, educators get into educator roles, and leaders get into executive leadership roles. So all the stuff that I teach in this webinar is applicable to all nurses. So if you're ready for a pivot, you're ready to move, you want a career change, please come to this webinar. It's not just for new nurses. I just love my new grads and tailor a lot of this to them, but it's applicable to everybody. And I also have a coaching program that I will talk about at the end of the webinar. And if you're eligible and you meet criteria, you'll be able to book a one-on-one call with me at the end. Okay. Okay, perfect. So Jasmine says she is a labor and delivery. She wants labor and delivery, and she's a senior nursing student. Okay, cool. Tell me what city you want to live in and work in. I don't know where you are currently at, so drop it in the chat. Same thing for you. If you're watching the replay, drop what city you're from. Let me know where you're from. Let me know what specialty area you want. Let me know if you're a nursing student, a new grad, or a career changer. If you want to change careers or like specialties, drop it in the chat. Okay. And literally, to backtrack, that tell me about yourself question, like I said, when it sets the tone should be like, oh, like they should be smiling and be like, oh, we already got our candidate. Like we could just stop the search right now because we're going to give this person the role. Like that's what you got to do. You got to be a showstopper. And I call it the interview pitch because you're pitching yourself, you're marketing yourself, you're self-promoting. And you're so self-assured and confident that like this is your job. And you just got to go and grab it and really connect with the interviewer. Okay, NYC, specifically Brooklyn. Okay, Jasmine. I used to live in Brooklyn, so we got Brooklyn in the house. Okay, cool. So let me know if you guys have any questions. Drop it in the chat. Number 2, we talked about preparing stories. You don't want to just leave it to chance. You want to have your stories prepped. I would recommend at least 3 to 5 good stories. One story you need to have is an above and beyond story, a story where maybe you detected a change in condition and what did you do about it? So like an escalation type story. Maybe when you were part of a team, what role did you play? Was it an emergency situation and what did you do? Kind of those types. And then I don't know why, but they love the conflict type stories. They might ask you, have you had a conflict with a coworker or conflict with a patient or family member, and how did you handle it? But what I like to prep my clients with is try to take it from a customer service perspective, which is that patient experience perspective, that service recovery. So you need to be really, really good at dealing with that. And then of course, one quick tip I always say is like, tell them that you're really good at problem solving and conflict resolution. And communication is a big piece of that you get along well with people, you know how to communicate, you stay calm, you're professional, you have emotional intelligence, and you're able to de-escalate situations so that they don't get out of hand. And all of that can be handled through communication, both verbal and nonverbal type communication. All right, boom, you're welcome. So that is the story piece. Do not memorize these stories. Like, don't sound scripted or rehearsed. You want to tell it in an engaging way and you want to get to the point. Like, what was the big action item that you did that changed the trajectory of the whole situation, and how did you make it better? That's essentially what they want to see. And what is like your behavior and quality like, okay? In these difficult situations. Number 3, of course, it's a given, clinical style questions. Let me tell you, this will make or break your interview. This is where most new nurses go wrong. Let me give it to you straight. Just because you passed your NCLEX doesn't mean that when you go to this interview, they're not going to grill you on clinical style questions. They will, especially if you're going to a critical care setting like labor and delivery, like Jasmine, you're interested in L&D, ER, ICU. Trust and believe you will get grilled. I mean, anywhere you can get grilled, but especially in those areas because it's high acuity, high risk style patients. So you got to know what you're talking about and have a really good handle on these clinical style questions. I have a great video on YouTube. It's taken off. I think it's like 17,000 views right now. Go check it out. It's, I believe it's titled Every Clinical Question That Every New Grad Should Know. Go and type it, like literally type in Dr. Farah Laurent or type in The Nursing Dose with Farah and look me up on YouTube and subscribe to that channel and go check out that video. I'm telling you, it's taken off. Everybody loves it. And it's a good breakdown of a lot of the clinical style questions that you'll get asked. Okay. And even if you're a student and you struggle with assessment, go watch that video. It'll break it down. So it will simplify everything so that you'll understand it really well. So the big tip here is obviously know the common emergencies of where you're going. So if it's L&D, hemorrhage is a big one, eclampsia, preeclampsia, those types of things, whether it's postpartum that you're going to or L&D, you got to know your stuff really well. Okay. And then the common things like, everywhere, like how to handle chest pain, potential stroke symptoms, hypoglycemia, all that. The video covers it all. So go check it out. And again, if you haven't signed up for my free webinar and you're just joining me, my name is Dr. Farah Laurent. I've helped over 200 new nurses land their dream role in competitive cities like New York City and San Francisco, helping new nurses get jobs in the ICU, the ER, the NICU, psych, L&D, you name it, in less than 3 months. Come to my free webinar this Thursday at 1 p.m. Eastern or 10 a.m. PST. If you have any questions about job search or interview, drop it in the chat. I love creating new content for my YouTube channel and also through all these platforms. If you're not following, make sure you follow me and subscribe to my YouTube channel because I'm trying to get that YouTube button. Let's go. Support me. And y'all, guess what? I literally just, YouTube sent me like the application where I can actually apply to be a partner. So my videos, they need some support. And I need new ideas. I need to know what you guys really want so I can create more content that is valuable for you guys, okay? How many stories should I have saved up? Okay, yeah, 3 to 5 stories, okay? And then some of these behavioral style questions and clinical style questions, they're essentially just want to know your thought process and are you able to critically think? Are you able to prioritize? And just problem solve, just general problem solving. They want to know, and are you able to adapt quickly? Okay. Let me know if this is helpful. Put hearts, put fire, put gems. Let me know in the chat if this is helpful for you. And let me know if you've joined. Jasmine already joined the webinar. Let me know if you joined the webinar. It's called the New Nurse to Dream Role webinar. It's free 99, y'all. You get to spend an hour with me. You can ask me questions at the end, and I will present my coaching program to see if you would be eligible to get in my coaching program. Okay. And do I take new graduate nurses? Yes. Do I take senior nursing students in my coaching program? Yes. And do I take nurse practitioners? Yes. Or anyone that's wanting to transition to a new role? Absolutely. You can still come to this webinar. Okay. If you are a nurse, you are welcome to come. If you're a senior nursing student, welcome to attend. Link is in the bio or go to newnursejob.com to sign up. Okay. All right. Next. These ones are pretty straightforward. So number 4, how to not blow your next interview, because think about it. You work so hard to get to the interview stage, right? So many people right now, so many new nurses are struggling to even get to the interview stage. That's a whole nother episode. I think I did another episode on that. So go check it out on my YouTube and my past lives. But quickly, if you're struggling to get interviews, it's because you don't have a good resume, you don't have a good cover letter, and you don't have a good strategy. And you're applying to too many jobs. Like, stop applying to all the jobs. That is not a strategy. Be very strategic and be in alignment with what you actually want. And if you don't know what you want, it's okay. Come to my webinar. We'll walk through it. Okay? So, number 4. Confidence can make or break your interview. All right. And then you might be thinking like, well, I'm a new nurse. How am I going to show up confident? Okay. It's through preparation and through competence. The more prepared you are for your interview and the more competent you are in terms of clinically sound, that you know your stuff, and you're very competent in the clinical side of things, it's going to translate to more confidence. Same thing with preparation. You're not going to prepare for your NCLEX the night before, just like you wouldn't prepare for an interview the night before. This is why I created the New Nurse to Dream Role coaching program, which I will present at this webinar. My clients know they're not going to come to me the day before and be like, I have an interview. No, we start prepping for interviews weeks before. Okay. All right. I have a question. Would you recommend IMC unit for the new grad? Cool. Let me know what an IMC unit is. There's so many acronyms these days. I have no clue. Drop it in the chat. What is an IMC unit? And you know what? I recommend any unit to any grad if you're interested in that patient population, and if you feel like that it's a good facility, a good hospital system that has a residency program, or at least has a good onboarding or orientation program that'll support you from your transition from nursing school to nursing practice. And when you go to the interview, remember that you're also interviewing them. If the interview is a hot mess, nobody knows what they're doing, they're super unorganized, there's a lot of tension in the interview, you don't feel welcome, you're taking a tour and like it's chaos, you can kind of feel that. You might be like, ooh, you know what? I don't know if I want to work here. It's a two-way street, the interview. All right. So number 4, you got to be confident. So definitely preparation and being more competent in your clinical style questions and just your overall interview. And that's what I do, y'all. This is my specialty. As a nurse career coach, I prepare you to slay these interviews. So much so that most of my clients are getting same day offers in ICU, in ER, L&D at places like Stanford and NYU. Okay. Number 5, the worst thing you can do is not have any questions at the end of the interview. Some of you might think like, oh my God, I just got through the interview. Like, I don't even want to ask any questions. I don't want to sound like I'm a burden and ask questions. Well, you got to ask at least a few questions. I would say 2 to 3 questions at minimum, because if you don't have questions, they're going to think, did they not prepare for this? Like, are they interested in the role? Do they not want to know more? You got to have at least 2 to 3 questions lined up. Okay. All right. What you saying? Intermediate care unit, also step down or progressive care. Yes. PCU. Yeah. I highly recommend it. If you want to be a critical care nurse, why not? And guess what? In my professional and clinical opinion, and also as a former ER nurse, former director of education and educator, I believe step down is one of the hardest units to start on, and it will make you a badass nurse. Same thing with the ER as a former ER nurse, okay? When you start in critical care, whether ER or ICU, you can go anywhere. Okay. So as long as you have a good orientation and a good preceptor, you're good to go. And that's for any area, really. Okay. So I'm coming up now on 30 minutes. So really, that's it for me. If you guys have any questions, drop them in the chat. I appreciate all the questions. Thank you, Jasmine, for dropping in. Thank you for your question about the intermediate care unit. And let me know, do you have an upcoming interview? What's going on? Drop it in the chat. And make sure that you sign up for my free webinar if you haven't signed up. And again, who is this webinar for? Any senior nursing student, any new graduate nurse that's been struggling to get to the interview phase or struggling with interviews, can't seem to get offers, and you keep getting rejection after rejection. This webinar is designed for you. And if you are just a nurse that's in any unit and you're ready for a career change, you're ready to pivot, definitely come to this webinar. Any tips for ICU new grad interviews? Could you give any tips for phone interview? Okay, cool. Yeah, so for the ICU, I would say you should join the AACN, the American Association of Critical Care Nurses. Anyone here that's interested in any area, you should join that organization. So for ICU, it's the AACN. For labor and delivery, it's AWHONN, the American Women's Health Association of Women's Health and Neonatal Nurses. For the emergency, it's ENA, Emergency Nurses Association. So there's one for everything. And then for the interview on the phone, you're probably talking about a recruiter. So number one tip is find out if it's a nurse recruiter, because there's a difference between a nurse recruiter and an HR professional recruiter. Obviously, a nurse recruiter is going to be more in tune with nursing, so they're going to know the terminology. They might ask you a little bit more deeper questions when it comes to nursing. But an HR professional is not going to know all the things that you're going to reference, so you're going to keep it high level. Same thing with anyone you interview with, even if you're in person or a virtual interview. Okay, so those are my tips. And then you should have a shorter version of an interview pitch on the phone. Same thing if you're going to a job fair, your interview pitch is going to be a lot shorter than a one-on-one interview. Same thing if you're going to a panel style interview with other candidates. You're not going to have time to have this long drawn out interview pitch. It's going to be the mini version of an interview pitch. Okay. So I hope that's helpful. Also on the phone, they're probably going to say, hey, why are you interested in this role? Tell me about your strengths, or maybe tell me a weakness. And they might say, why are you interested in working in this particular hospital system? And then they might also say in the beginning, tell me a little bit about yourself. But those phone interviews typically are about 10 to 20 minutes, sometimes shorter. And really, they're just screening you to see if they can get you to the next actual interview with the hiring manager. So take it seriously. And then you want to sound enthusiastic, you want to smile, you want to laugh, so that you're sounding a little bit upbeat and more interested in the role. Okay. Are you able to ask to tour the unit? Yeah, absolutely. If they do have time at the end, you can say, hey, I'm not sure if you have any interviews after me, but I would love to tour the unit. Is there a possibility that you could take me on a quick tour? And even if they have somebody after you, somebody maybe could take you on a quick tour so then you can actually see the unit. And I highly recommend that you do ask for a tour. All right, y'all. All right, so this is it for me. It was so much fun answering everyone's questions. Please connect with me on LinkedIn if you're not connected with me on LinkedIn. And also follow me on all the platforms, but specifically go to my YouTube channel and subscribe to the Nursing Dose with Farah. And of course, don't forget to sign up for my webinar this Thursday, newnursejob.com. I'll drop it again on LinkedIn. Newnursejob.com. On TikTok, if you're here, Literally, when I log off, just go to the link in my bio, click it, and you can sign up for the webinar. Same thing on Instagram, LinkedIn, and Facebook. And then if you go and subscribe to my YouTube channel, you'll see on the bottom description, just go to the Nursing Dose with Farah. And on the bottom, you'll also see a link on YouTube where you can click and register for my webinar. And it happens this Thursday, 1 p.m. Eastern, 10 a.m. PST. All right, Jasmine, I look forward to seeing you on the webinar. And everybody else who has signed up, you are welcome. Again, I'm out. My name is Dr. Farah Laurent. I'm a nurse career coach, keynote speaker, author, and I help nurses level up, land their dream role in less than 90 days. And I will see you in the next webinar. Take care. Thanks for watching. Bye.